My name is Kim Berry, and I'm going to be demonstrating an intramuscular injection today. Before I did anything else, I would gather my equipment. I have a pair of gloves, 2 alcohol swabs, my vial of medication, a 3 ml syringe, and a needle. And then my grapefruit is going to represent my patient. So first, I would get the medication out of the med cart or the Pyxis machine. I want to check the label, so I have 0.9% sodium chloride, and that is exactly what my patient is to receive. And the expiration date is May 1st, 2015, so I know both of those are good. I'm also going to calculate the drug dose if it's not given in the medical administration record, and I will double check that dosage after I calculate it once. Again, I'll read the label before I draw out my medication, so 0.9% sodium chloride, and that's exactly what my patient needs. So now I'm going to swab the top of my multi-dose vial. If this were a brand new vial or a single dose vial, I would not have to swab it. I would just pop the top off. And I'm going to remove the cap of my needle. I will then enter 1.5 ml of air into my vial to make it easier to withdraw the medication. The dose of my medication is 1.5 ml, which is why I would use that amount. So after I have my medication drawn up, I want to make sure I have no air bubbles. Any air bubbles in my syringe, I would want to put those back into the vial and withdraw the medicine, making sure that I just have medication in my syringe. So now that I only have medication in my syringe and I have put all of the air bubbles back into the vial, I can take my syringe, my needle out of the top of my vial, and I will recap that needle. So this is the drug that I will be giving the patient. So one more time, I'm going to read the label and check it with my patient's MAR, and then I'm going to enter the patient's room. I would perform hand hygiene when I entered and identify my patient with 2 identifiers. So I'd ask them their name and date of birth. I would then proceed to ask if they have any allergies and double check that with their chart. And lastly, I would tell them what drug they're going to receive, what it's for, any side effects that they might need to look out for, and I'm going to tell them how they will be receiving it. If the patient has any questions, I would be able to answer those at that time. So next, I'm going to get ready to administer my injection. I'm going to don gloves. And I will be positioning my patient for the shot. So if I was giving this injection in the deltoid muscle, I would locate the acromion process at the top of the shoulder, and my injection site would be 2 to 3 fingers down from that in the middle of the arm. So to prepare my patient's injection site for the actual injection, I will use an alcohol swab and swab the area. I want to make sure that's nice and clean so that I don't introduce any germs into my site and the underlying tissue. So I would then use my cotton swab to point towards the injection site so that I can remove my hands from the area. I will then remove the cap of my syringe, and I will pull the skin tight because it's an intramuscular injection. I will then insert the needle at a 90-degree angle. I will aspirate to make sure there's no blood, and there's not. So now I will inject the drug at 1 ml per 10 seconds. I want to wait a second before I withdraw the needle and pull straight out. I will then push down the safety on my needle, and I would discard this in the sharps bin. I will put gentle pressure on the site with my cotton swab, with my alcohol swab, and I can remove that. I would put a band-aid on it, and I'm finished. So after I am done with the injection, I would make sure to document the site of the injection, the amount of drug, and the time, and I would also initial that. Thanks for watching.